everyone, welcome back to my channel. Today's topic is fall injury for medical surgical nursing. Let's get started. Introduction of fall injury. Fall injury is an event in which a person comes to rest inadvertently, abnormally on the ground or floor. Fall injuries can be common in elderly people as well as in children, because they are just learning how to stand, how to walk, and then they are learning, they are in growing phase. That's why they might face fall injury, especially toddlers. Elderly, they face fall injury. As we are concerned about elderly, they face fall injury because their limbs, their body muscles becomes weak gradually with age. So using their weak limbs, weak muscles, they are not able to coordinate their movements properly. As a result, they face fall injury. This is a diagram of fall injury. Risk factors for fall injury can be, first of all, intrinsic and then extrinsic. Intrinsic factors can be factors related to internal part of the body, that is, age-related degeneration in the body. An extrinsic risk factor can be any kind of drug, improper assistive device, inflammation of the joints, arthritis, gout, hypotension, regularly continuous hypotension, auditory or visual abnormalities due to which movement can be difficult, tremors of the body, involuntary movement of the body. Also, equilibrium disturbance due to production and use default, there can be equilibrium disturbance due to which fall injury can occur. And then foot problem. Foot is the main weight bearing organ of the body. So if there is any kind of foot problem, there can be chances of fall injury. Foot problem can be arrhythmia related to cardiovascular system, heart block or valvular disease, leg length discrepancy when there is unfamiliarity between length of both legs, lack of conditioning. Conditioning means generalized. Conditioning is a proper functioning, smooth functioning. Lack of conditioning is lack of smooth functioning. Some kind of illness because of malnourishment, malnutrition, and also due to gait disturbance. Because of disease like alcoholic liver disease, there can be gait disturbance due to which fall injury can occur. Consequences or results of fall can be, first of all, physical consequences. Skin tear can occur. Till epidermis or dermis, there can be injury. Or if there is fracture, injury is much more deeper. Internal bleeding or hemorrhage can occur. Also, hematoma can occur within the bones. Disability might occur due to fall injury. Psychological consequences are fear of falling again. Once the person falls, there is fear of falling again. That is, they fear of having injury again, and that leads them to dependency. They become more dependent upon others because they have fear of falling. And they also lose their confidence for their daily activities. Features of fall injury can be, first of all, orthostatic hypotension. In orthostatic position, there can be hypotension, visual and hearing abnormalities, presence of arrythmias and carotid bruits. This is carotid bruits, some abnormal kind of sound that can be heard in near the carotid blood vessel. Focal deficits can occur, that is, miscommunication between brain and sensory organs. Weakness of extremities can occur due to fall injuries. Also, there can be limitation in range of motion. You can assess as a nurse, you can assess fall injury by obtaining history. First of all, while collecting history, you can ask about mechanism of fall, location of the fall, activity of the patient, witness, and first aid that was provided at the site. Also, you can ask some associated symptoms because some of the symptoms can be threatening. You can ask about symptoms like change in the level of consciousness, chest pain, confusion, palpitation, dizziness, or numbness of muscles. Also, you should ask about medical history, that is, any disease which patient is suffering from, any medicine that the patient is taking, previous fall history, before this event, any fall history that the patient has faced, also social history. If the patient lives alone or with family, social history can be collected. Physical examination can be done. We can observe general looks, hydration status, postural changes, visual and hearing abnormalities while examining the patient. All this can be a risk factor that has contributed to the fall injury. While examining cardiovascular system, we can check presence of arrythmias, carotid bruits like the previous diagram, neurological and mental problems, focal deficit, vibration sense, extrapyramidal functions. Also, musculoskeletal abilities or functions can be determined, like lower extremity weakness, presence of contractures, already presence of contractures, limitation in the movement or pain while moving, joint function limitation, difficulty in moving any kind of joint, that can be a sign of something problem in the body. Also, we can perform extra testing or imaging. That can be complete blood count, electrolyte, blood urea nitrogen, creatinine, glucose level, vitamin B12 level. Patient can be malnourished. So, vitamin B12 level. We can perform X-ray, ECG, echo, and MRI on the patient. Fall injury mainly contains the content of fall injury is directed towards prevention rather than management. Yes, we can manage. We can manage by providing nursing care, but preventive measures become more important as this is an accident. This can occur, fall injury can occur as an accident, not as a disease condition. Okay, it occurs suddenly. So prevention can be, first of all, the patient who are at risk, they should be provided special care, like the patient of osteoporosis, patient having joint arthritis, joint inflammation. They should be cared a little bit more because their movement are limited. Multifactorial intervention should be done to address the risk factors that we need to identify to prevent fall. There should be vitamin D supplementation, weight training, exercise, food problems, footwear assessment, everything should be done so that they can themselves contribute in their prevention of fall injury. Also, we can provide opportunities for socialization and encouragement. Family can be improved, family can be involved in the care so that patient's condition can be socially improved. Rehabilitation can be provided. Rehabilitation is providing optimum function to the patient. The functions that they have lost can be provided to an optimum level through rehabilitation. Thank you so much.